Shoulder pain. Your health and well-being is important to all of us. Today, your healthcare provider has requested that you watch this brief video. Does your shoulder seem to be more stiff and painful than it used to? Do you notice a tight feeling in your shoulder when doing certain recreational activities? Are you unable to perform routine household chores without pain? Over the next few minutes, you will learn the types of shoulder pain, how they develop, and what you can do to resolve the pain and gain better health for your shoulder. The shoulder is a complex collection of bone, cartilage, bursa lining, nerves, tendons, ligaments, and muscles. Because the shoulder is so flexible, it is also somewhat fragile and susceptible to wear and tear and injury. Overuse or underuse of the shoulder can as well trigger the onset of painful conditions that will, if untreated, lead to restricted movement and use of the shoulder. Neurological referred pain is pain that radiates from the nerve roots in the neck to one or both shoulders. Various activities and conditions can compress and inflame cervical nerve roots. Referred pain is usually a dull ache that gets gradually worse. Without proper treatment, the pain can advance into the arm with symptoms that include weakness and numbness or the sensation of pins and needles. Degenerative arthritis is the result of the normal wear and tear that can occur to the bones, cartilage, and bursa of the shoulder. Over time, the smooth head of the humerus, the upper arm bone, degenerates. When that occurs, the cartilage and bursa no longer protect joint surfaces as they rub together. The pain associated with degenerative arthritis is a dull, persistent ache that is aggravated by activity. Without proper treatment, the pain becomes harder to relieve and joint immobility increases. Bursitis and tendinitis are irritation or inflammation of the protective linings and connecting tissues of the shoulder joint. Repeated lifting, reaching, or other overuse activities can injure the bursa and tendons. Bursitis and tendinitis pain is usually pinpointed to specific areas within the shoulder. Without proper treatment, bursitis and tendinitis pain and immobility get progressively worse. Rotator cuff pain occurs when any of the four rotator cuff tendons become inflamed, stretched, or torn. When this happens, even the slightest movement of the shoulder is painful. The range of motion in the joint can become quite limited, and joint stability is decreased. Without proper treatment, the condition worsens and immobility increases. Certain types of rotator cuff injury can be treated by chiropractic. When shoulder pain exists, it is only natural not to move the joint when pain occurs. Lack of movement, however, can allow adhesions to develop in the joint. Adhesions are collections of firm cobweb-like fibers that cause tissues in the body to stick together. Adhesions trigger more pain, which leads to less movement. Without normal use, the adhesions get worse and the bursa can become inflamed and swollen. Without proper treatment, you may wake up one morning to find you cannot move your shoulder at all. You have developed adhesive capsulitis or frozen shoulder, and at this point, any movement, even breathing, causes severe pain. When you visit your doctor because of a painful shoulder, you may be asked to complete a number of tests to diagnose or rule out the possible cause of the shoulder pain you are experiencing. These tests may include X-rays, an MRI or CT scan, or even lab tests that can usually rule out those internal problems that may cause shoulder pain. Based on the results of those tests, your healthcare professional will prescribe the appropriate therapy, exercise, and home care programs that will provide relief from the symptoms you are experiencing and help restore movement and mobility to the shoulder. In the event that your condition warrants advanced levels of diagnosis or care, your healthcare provider may consult with or refer you to medical specialists such as a neurologist, orthopedic surgeon, or internist. The do's and don'ts of a healthy shoulder include: get treatment if you feel pain or instability. Learn to use your shoulder safely and correctly. Perform shoulder exercises as shown by your doctor or therapist. Don't overuse your shoulder. Know when to rest or change position. Don't underuse or immobilize your shoulder. Lack of movement can lead to a frozen shoulder. Don't ignore pain in your shoulder. The earlier a problem is detected, the greater the chance of avoiding surgery. If you are experiencing pain, discomfort, or lack of mobility in one or both of your shoulders, your healthcare professional can diagnose the specific cause of your discomfort and use adjustment and manipulation techniques as well as other proven therapies to provide relief and restore mobility to the most flexible and fragile joint in your body. Your healthcare team has a star player, you. With you leading the way towards a better state of health, it is important to keep all appointments, follow your treatment plan for longer-lasting results, exercise as instructed, eat properly, and follow stretching and ergonomic recommendations. Working together as a team, you and your healthcare professionals can decrease the likelihood of future problems, prevent degeneration from advancing, decrease relapses or flare-ups, and stop the development of chronic pain syndrome. A better quality of life is the wellness goal to better health. With more knowledge about your shoulder and how to keep it healthy, you're on the right path to achieving that goal. If you have additional questions about the information presented, please ask your healthcare provider for assistance.